I'm a uni student, and when we went into lockdown, I lost all my jobs. Uni moved to online, which meant that I was stuck inside all the time. My mental health took a huge hit and I spiraled and desperately needed help. I can't get an appointment with a psychologist or psychiatrist for weeks, sometimes months and months, because they are so overrun due to COVID-19. The counsellor I contacted was not covered by Medicare, which meant that it was unaffordable for me. What is the government going to do about the availability for mental health services, especially during COVID-19?
Okay, at this point I want to bring in Helen Christensen, who's here from the Black Dog Institute. Can you just, from an informational point of view, what is actually available? Where are the gaps for young people on this?
I think we've already heard where the gaps are, or some of the gaps are. But what we're finding is around 75% of young people say they have mental health problems or concern.
75%?
Yes, and around adults it's around 45%. So the reality is young people are doing it harder. And if you look at the reasons, we're not on an even playing field here. Young people don't have jobs. It's easier to keep a job rather than get a new one. The number of hours available to young people is much lower than for older people. There's greater wage return if you're an older person. So it's not an equal playing field. And I think we have to be aware that young people are doing it hard, and for very good reasons.
The federal government has made an extra 10 Medicare subsidised psychological therapy sessions available for Victorians, for the rest of us. So that takes it to 20, I think. For everyone else, it's 10. Yeah. Is that enough? Does that solve this sort of huge challenge that appears to be in front of us?
It's not going to solve the problem. The problem is that our way of doing mental health care is very rigid. So people are allowed 10 sessions. Those sessions are an hour each. And there are only so many psychologists and psychiatrists who are available. So you can't actually get more efficient. Unless you get more efficient in the way in which you deliver healthcare, you're going to be stuck with the problem that you won't be able to get access. So there are ways that people are thinking about how we can change that. And there's something called blended care, where a person has less time with a clinician, but they do digital or online therapies as homework. These are evidence-based. And it's been found that if you have a single person delivering these sorts of therapies, they can see 9 more people in terms of their time and their efficiency than just one-on-one. So we have to get smarter. We could get smarter about how we do it.
I want to go to Ahmed. You're in Melbourne. Can you give us a sense of how acute this mental health issue is amongst young people you're dealing with there during this second phase of lockdown?
Absolutely. Young people here in Melbourne are struggling and absolutely struggling. And I'm going to talk about new and emerging communities and multicultural communities who I work with, especially vulnerable young people. And I spoke to a young person about a fortnight ago, and when we were having a chat, he said, look, I'm very stressed. You know, I live in a household, you know, no job, you know, 5 kids, you know, all of us around the house. We're all crammed in the one house. There is nothing to look forward to. You can't go outside. It's only 1 hour exercise. You come back. And, you know, he said, you know, me, my friends, you know, if we were ever experiencing anything, we'd never call some of these numbers like Lifeline or Beyond Blue. And he goes, you know, we're not, you know, our culture does not, you know, we've never been brought up to kind of call numbers and speak to a psychologist or speak to different health professionals. And that really brought the case to me. And I said, what do we do to fix this? You give me your first-hand experience. And he said, we need tailored and targeted supports to young people at grassroots level that engage with them, engage with their families, engage with the young person and, you know, meet an outcome. It's easy to just talk to a young person, but he said we need tailored and targeted, something that's culturally sensitive, also, you know, works alongside the different faiths and backgrounds they come from.
Ahmed, I wonder if you could share with us, before we came on air, you mentioned to me that your phone has become like a call centre in recent weeks. What are people calling you asking for? What do they need?
Unfortunately, you know, in Victoria, there's a lot of people who've fallen through the gap. A lot of families, a lot of young people who've fallen through the gap. Some families that are here on permanent residency who don't even have food. You know, they're contemplating either paying, you know, the rent or feeding their children. And this is very hard. And, you know, when you speak to different people, they say, why don't they access the hardship payment? You know, they've never accessed any of these support services in their lives before. They were working families. They were here, you know, they were able to sustain themselves over a long period of time. But this COVID really, the pandemic's really brought them to their knees. And, some of these families can't get support, and every time you speak to different people, they say, oh, there's hardship payments, rent relief, there's this. Families have had to move out, families have had to, miss meals. So it's really dire out there, and some families are really struggling and falling through the gaps.
Kate, access to mental health services is already an issue in rural and regional areas. Give us a picture of what it's like now.
Oh, it's definitely been made worse by certain things that people are having to deal with, being separated from families, not being able to see kids when they're in different states and things like that. But as you said, we know that regional and rural Australia have significantly higher suicide and self-harm rates. And that's something that hasn't been addressed. And part of that has got to do with the digital connectivity that we have. We don't have the option in some places to even pick up a phone and call places like Lifeline. And I think this is something we seriously need to look at, not just throughout this pandemic, but even before this pandemic, that our rural Australians are struggling.
Hamani, I know you've had some issues yourself with mental health. How are you finding this time? How's the isolation? How are you coping?
Be quite honest, it's quite hard being in isolation, but I know it's the right thing to do because I'd rather be inside and not interact with anybody than go out and get sick. I do have that feeling of anxiety and that stress of uncertainty of when is this gonna end well? Isn't it gonna end bad? Because you don't know what's gonna happen in 3 weeks or next week or tomorrow. So that's what I think in the back of my mind.
And if you don't mind sharing, have you been supported? Have you been offered help? Have you reached out to any of these services?
Yeah, I've reached out before COVID. I've reached out during COVID. I've reached out. I'm quite grateful that I have services that are available in my area. I know that there are other areas, especially in rural Australia, they're in hardly any, little to none. I'm quite thankful that I have these services available near me.
All right. Well, I should point out that if you or anyone you know needs support, there's a range of support services. We talk about them regularly here, but always worth reminding you the contacts for Lifeline, as well as the Coronavirus Mental Health Support Line and the Kids Helpline are now on your screen.